Hi, Nicole. How are you?
I'm good, thank you.
Thank you so much for taking the time to do this with us today. We're very happy to have you. Would you maybe like to introduce yourself before we start getting into the questions?
Yes, thank you for the invitation. So my name is Nicole Wolfe. I'm the co-director of community engagement at the Southern California Clinical and Translational Science Institute at the University of Southern California.
That's great. Okay, so you're at the APHA today, and the theme of this year is rebuilding trust in public health and sciences. So would you maybe be able to speak to how your research specifically addresses this theme?
Yes, so our team works in the communities that surround our university campuses, and we are really focused on building trust in those communities. And these are lower income communities of color who have often experienced issues with researchers kind of coming in, doing work, leaving. And so there's been a historical feeling of exploitation, and that's really driven a lot of the mistrust that people feel. And so our team is made up of folks who are from the communities that we work in. And we conduct listening sessions, we do health education workshops, we do trainings, we're at community events. So we're really focused in maintaining a continuous presence in the community and building those relationships and partnerships, which are essential to be a trusted messenger of information.
That is wonderful. That is so good to know. Speaking about being, putting out the right kind of information out there, what challenges and opportunities, does your area of research face in terms of building public trust?
Well, I think we're in a moment in our society where there is so much information coming from so many different sources.
Absolutely, yeah.
And so for a lot of people, it can be hard to know what to believe.
Yeah.
And what we learned during COVID was that the news and the just sheer quantity of information was just overwhelming. And that caused people to just tune out. And what people really did was go to their trusted messengers, whether that was their faith leader, whether that was their doctor, their child's doctor. And for the communities that we work with, it was also us and our team.
Yeah.
And so we really are committed to continuing to be that source of trust so that we can ensure that we're providing folks with accurate information and information that is culturally tailored and language specific. So we work with Spanish-speaking Latino populations. We work with Black African-American populations. And so it's beyond just kind of the literal language, but also ensuring that we're sharing this information in the way that folks communicate and that they can understand. And so we have native Spanish speakers on our team. We have community health workers, promotores de salud, and again, people who are from the communities in which we work. So there is that personal knowledge and understanding. And so we take a lot of care to ensure that the materials we provide to community members, again, are not only accurate, but culturally tailored and language specific.
Wow, that's really, really wonderful. Would you maybe want to share an example from your work where you had to actually navigate public skepticism or misinformation?
Yeah, so one area, and unfortunately there's a couple, but I'll focus on one, which is the area of research. And so we do both community level workshops about research, which we call Research 101. And we also do a 12-hour training for community health workers and promotores de salud called the Fundamentals of Health Research.
Okay.
And so this really tackles issues around research in general. What is research? What are clinical trials? What are different types of research studies? We talk about some of the historical experience of these communities, right? And which has sown a lot of this mistrust among folks about participating in research. And we hear a lot, we're just guinea pigs, right? Where this is not about us, this isn't going to benefit us. Yeah. So we are really focused on increasing participation of underrepresented populations in research because we want to ensure that for the researchers we work with and just in general, that whatever interventions come out actually help the widest group of people possible. Yeah. And I think we all know that historically, most of the participants have been white and white men, and that's just simply not representative of the population. And so we don't want people taking medications or, that weren't tested in their population. And so this is something that we're really committed to.
Yeah.
And then we also work with researchers to ensure that they are doing a good job at taking a community engaged approach and that they're really sharing information with folks in the community. They're sharing back the information that they learned. And so this has been an area that we're really focused on.
That's great. One of my favorite things about the conference this year is that there's so many people from different walks of life here, so there's researchers, there are academics, federal agents, but they're also, they're not just, they're also policymakers,
Right.
Involved in the actual decision making. How do you think public health professionals in general can better communicate the scientific findings to build trust within these communities, especially some of the communities that you work with, who may not have as much access to resources as you would like them to?
I think one big issue is that it really comes down to respect.
Yes.
And to really respecting everyone, particularly folks in these communities, folks who have participated in research. And I know in academia, academics and professionals are understandably very focused on their career. And a lot of times the dissemination component is really focused in that direction instead of sharing back the information to the community. And what we've seen is that even small outreach, like a town hall event, putting a one-pager together, there are kind of small ways in which folks, researchers can share back that information that goes such a long way. And I think if researchers or public policy professionals really come at this from a place of respect and partnership.
Yeah.
So this is something else we speak with researchers about, that those people who have participated in your study are not just your subjects. They're not even just your participants. They're partners in your research.
Yeah.
And so I think if that gets reframed in that way, then it'll become much more normalized to share information back, just like you would with any other partner who's involved in your research.
Absolutely. No, and at JMIR, for example, we're an open access journal because we truly believe that information and knowledge is for everyone. Mm-hmm. So, no, completely, very, very, I completely agree with what you just said. That's very important for us. I think I like this question a lot. Okay. How do you think public health research practices have changed since the pandemic? I know that you work with researchers or you speak to them a lot. Do you think that researchers are now working on new ways to combat misinformation? Or do you think there are new ways that researchers could maybe adopt to battle misinformation?
I do think that the pandemic and that experience made researchers much more aware of the problem of misinformation and disinformation. And so that is something that is now kind of more top of mind. And at least I know in our situation that we have more researchers who are contacting us and our community engagement group to be able to kind of talk about how we can connect with folks, right? How we can help them connect with folks. So I do think there's at least a little more awareness about it. Yeah. I do think it is kind of changing practice for folks, and that takes longer or shorter for some. Yeah. But I do think it's starting to go in the right direction because, like I said, I really think the pandemic made very clear how much misinformation is out there and how damaging it can be.
And it was on everybody's fingertips, right? Like WhatsApp University or like weird YouTube videos.
Right.
Yeah. Okay.
Exactly.
Yeah. Well, Nicole, this is my last question for you. So what role do you think presenters and attendees at this conference or, any other conferences could play in collectively addressing the issue of creating trust in public health or in communities?
So I think, one, that the presenters themselves should be talking about this throughout kind of every poster session, every talk, and really ensuring that all attendees have the opportunity to be hearing about this. And like what you said earlier, is that this conference is made up and has people from all over, right? All over the world, all walks of life, all areas of work. And so it really presents a good opportunity for networking and connecting and learning from one another and being able to take some of those lessons learned back into their group. So I think it's just continuing to have these conversations and continuing to kind of name it and maintain awareness around it.
Yeah, that sounds wonderful. Thank you so much for your time, Nicole.
Yeah,
it has been
thank you.
such a pleasure talking to you.
Yeah, thank you for having me.
Yeah, absolutely.